Now coming to advantages and disadvantages of dried blood spot sampling technique. The advantage is very small amount of blood is needed, like less than 100 microliter blood is needed for this dried blood sample technique. Or another advantage is uh, small volume of blood is this is very good for pediatric sampling, uh, like in taking blood sample from peds. Also, the accuracy of dried blood spot is influenced by many factors. uh, I will discuss about the factors that affect the accuracy of dried blood spot later on. Also, further uh, going to advantages like uh, dried blood spot is minimally invasive sampling. Patients can perform the fingerprint at home easily. No any need of phlebotomist. Uh, also, patient there is no any need of wait as in the hospital for sampling method. Like it can be easily done at home by a layman person if the layman person is trained by a phlebotomist or any trained person. So in young children or neonates, dried blood spot sample is taken from heel prick, like foot heel prick. Um, Most analytes are more stable in dried blood spot than in frozen samples. Some different drugs are stable at various temperatures. In conventional sampling, we take sample of blood from veins, then collect in tubes, then they are frozen actually uh, because of stability issues. But in dried blood spot sampling, there is no need of any machine, any equipment, any electricity, any refrigerator. So that's why dried blood spot sampling is a good technique for the remote areas, any limited resource areas where electricity is not facilitated to the people, or any other equipments or machines are not available. Like backward areas. Also there are some other advantages, like can be easily dried blood spot sample can be taken, and then uh, it is dried for 2 to 3 hours. Blood spot is allowed for drying for 2 to 3 hours. Then it is collected in bag. Name of patient is written on the sample, on the filter paper. Filter paper is of different types used, like that is known as Wattman 403 is a brand name of filter paper. I will further discuss about this in next video. So in the bag, collected in the bag, then it is mailed by courier service or vehicle to the laboratory for analysis. So there is no need of temperature management or any other type of issue. So there are some disadvantages also. Only small volumes are available in dried blood spot. So a very sensitive technique is needed to evaluate a drug of interest. Like I already discussed that ultra pressure liquid chromatography coupled with mass spectrometry is needed to evaluate the sample. Why? Because very small volume of blood is taken in dried blood spot. So sensitive techniques are needed to evaluate to extract the concentration of our drug. There are other some extensive validation is required. The impact of variations of hematocrit values on the spot size and homogeneity should be understood. Like hematocrit is volume of red blood cells. Red blood cells volume is different in different samples. Like if the hematocrit value or volume of red blood cells is higher, then there will be higher viscosity of the dried blood spot. If the viscosity will be higher, then there will be a non-uniform distribution of drug or drug of interest. So hematocrit value should be lower or normal. Uh, if the hematocrit value is higher, then there is a large volume of red blood cells, and this affects the spot size and homogeneity and uniformity of the blood spot. Also, it affects the recovery, uh, like analyte recovery. It also affects analyte recovery, extraction of drug. These all things are affected in the dried blood spot. Also, there are other some factors uh, that affect the overall performance, uh, overall like result of the dried blood spot technique.